All right, we're live. It's Good Friday afternoon at this point. Welcome to the webinar series with the Arkansas Public Policy Panel, where we talk about the issues in Arkansas that we're advocating for or against to help improve the quality of life of all Arkansans. And we're back with another Friday webinar, August the 1st. So we are bringing it live and direct to you the first day of the month, getting everybody prepared. And we got a great guest with us today. I got Camille from Arkansas Advocates for Children and Families. She is the Health Policy Director for Arkansas Advocates for Children and Families. And that's one of our biggest partners, a lot of the work that we do. So pleasure to have you again, Camille. How you doing?
Always a pleasure, Osiris. I'm doing pretty good. Trying to beat the heat right now.
Yeah, you know what? You should be looking forward to Sunday morning. We're gonna have some real cool temperatures Sunday morning, so we're gonna be.
Thank you, weatherman Osiris. I haven't actually looked. I've just been dealing with it's still hot.
Yeah, it's hot. It's definitely hot. Appreciate you being here as a representative from Arkansas Advocates for Children and Families. I do a lot of work as far as policy and advocacy for the state of Arkansas, helping to ensure that all children and their families have all the resources that they need and making sure they're taking advantage of all the opportunities out there through your education and your advocacy. So thank you. And we're just going to jump right into it, basically. There's so much happening out there.
There's one might say too much happening.
Too much.
Happening,
Too much happening. Yeah, I like the way you put that too. Too much happening right now around federal cuts in this current administration. And there's going to be some real impact that's happening here in Arkansas as a result of those federal cuts. But before we start off, I just want to, let people know who you are and give yourself an introduction so that our listeners know who you are and what you do.
Yeah, happy to. So I'm Camille Rishu. As Osiris said, I'm the Health Policy Director at Arkansas Advocates for Children and Families, and I've been there almost 2 years. And so some of the work that I do is I lead our organization's work to improve health outcomes and do good policy for kids and families in the state. And I have a background in public health. I have my MPH from the University of Arkansas for Medical Sciences, and I'm a doctoral candidate in public health there. I have a background in research and overdose prevention, harm reduction, maternal health, some different cool areas, quality of life issues, and LGBTQ youth. And I am originally from South Louisiana, but Arkansas is my adopted home since I was a kid. I'm from Camden, Arkansas, where I grew up, where my mom, my sister, and grandma still live. And basically, part of why I'm at Advocates is that pretty much every policy and program that Advocates championed, I'm a beneficiary of. So I'm a Head Start kid, an Our Kids First kid, public education, hippie home visiting programs, and as a family whose my household was impacted by medical debt as a kid, and so being able to do this work is directly and personally important to me. So, yeah.
Thank you for sharing a little bit about who you are. I've been knowing you way before you got to Arkansas Children and Families, so it's great to work close with you in this space. And we really just want to educate the people. So I want this to be a very informative discussion, hopefully engaging with our listeners. I encourage the listeners that are watching on the live stream right now, if you do have questions, send them in. We're going to try to get to every question, and we're going to try to answer them the best we can. But just take advantage of this opportunity, like it, and hit the share button if you're on live listening right now. We're talking about federal cuts to Medicaid. These cuts are going to be are far-reaching. They have some detrimental consequences, and it's vital information because Medicaid is a vital safety net program as well. So I'll jump in and just ask you because you're uh, very knowledgeable on this, and so what would the rollback in federal Medicaid funding look like for families and our elders and seniors in the community in Arkansas? Who stands to lose the most?
Yeah, so a little bit of just making sure we know we're all on the same page. So Medicare and Medicaid often get mixed up a lot. So Medicaid is our program that is more focused on income-based, lower-income adults, kids, the Children's Health Insurance Program, people with disabilities. And Medicare is usually associated with seniors, but also folks with disabilities. They end up coming together a lot because people can have dual coverage, people with disabilities, other groups, other kids with special health care needs. But the majority of the bill that was passed into law, the one beautiful, big, beautiful bill, HR 1, however you know it, is mostly around Medicaid and SNAP cuts. So when you think about Medicaid, it is a major insurance program in Arkansas. Medicaid and CHIP cover nearly half the kids in our state. And the Medicaid expansion in Arkansas dropped uninsurance levels dramatically in Arkansas. So they have, like, so much of Arkansas's healthcare system is funded by Medicaid dollars. Is our rural health system is heavily reliant on Medicaid dollars, and Medicaid is a health insurance program. It's not, people don't get Medicaid checks. What Medicaid does is make sure that you can get preventative care. You can go to the doctor when you're sick. It makes sure that providers get paid, that they aren't taking on uncompensated care. It keeps your rural hospitals open. It pays for half of the births in our state. So there, with this bill, with the rollback and those cuts, there's some indirect and some direct cuts, or kind of what we call impacts of that. So the Congressional Budget Office estimates, with the bill that was passed into law, that around the United States, gross Medicaid and CHIP, Children's Health Insurance Program, spending is going to be cut by $1 trillion over the next 10 years. So hundreds of billions of dollars are no longer going to be coming through. Between the cuts to Medicaid and the marketplace provisions in the bill, you could see in the U.S. as many as 15 million people uninsured in the next 10 years. And hundreds of thousands of Arkansans, or at least thousands of Arkansans, are expected to lose coverage because of different parts of this bill. So there's those like very much immediate direct impacts. So your loss of coverage is loss of dollars. But then you think of the ripple effect of that. When you don't have millions, billions of dollars over the next 10 years coming into Arkansas, in a state that is so reliant on those dollars to keep our rural hospitals going, to pay for births in our state, you're going to see sort of a collapsing of, your rural hospital in your hometown. I know the rural hospital where I'm from is barely hanging on by a thread. So I'm thinking about the direct and then the ripple effect over the years.
Definitely. Yeah. And we both our organizations work in rural Arkansas, so I think a lot of what you're talking about is definitely going to resonate with the people that support our organizations. Uh, you know, I feel like because of social media and because of just the trend and way things are going with AI and everything like that. This feels like an age of misinformation, uh, and and I feel like a lot of people take advantage of that. In particular, our politicians. And so my next question for you is, what are the myths or the narratives that are being pushed by the politicians to justify Medicaid cuts, and how can advocates dismantle those narratives in our conversations?
I think so. I'm going to talk about maybe a couple of the arguments that I've been hearing, but the first thing I would encourage is to not take the bait on some of these arguments. So the main kind of thing we've been hearing from those who are supporting this bill is this isn't, cutting care, this is cutting fraud and waste. This idea that this bill is about fraud and waste is it needs to be countered. It's just a lie. And I would say don't even play ball with that, because what this law did or will do, it increases healthcare costs and it's stripping insurance for millions of people, period. So when you get into the weeds about what is fraud and abuse and all those things, which the overwhelming majority of Medicaid and Medicare fraud is on the provider side, on the billing side, it's not on the patient side. But what the bill does not actually address it. In some ways, it makes it, it just makes it harder, and it puts up a bunch of barriers. It's seeking a solution for a problem that doesn't exist, and all it does is cut care for people. So I would just say this bill is cutting healthcare funding to our state, and is going to result in people losing coverage. And when you kind of take the bait with that, things get kind of muddied in that way. So some of the provisions specifically that people are talking about are things around work requirements. So one of the largest provisions of the law was enacting around the country work requirements for Medicaid. A third of that cuts actually come from this. And the fact that they expect that work requirements will lead to people's losses in coverage shows that it's not about increasing jobs or anything like that. It's just about taking people's health care away. And the people who are losing coverage and who lost coverage whenever Arkansas tried this policy in 2018, there are people who were everyday Arkansans who were trying to get by, fast food workers, people who serve our food, restaurant dishwashers, construction workers, janitors. There are many people who live with disabilities and chronic health conditions, people who were gig workers who had shifts that changed the number of hours that they got. Most of the people who lost coverage during that time should have been exempted or were meeting their requirements. They lost it because of paperwork. They lost it because of the labyrinth of the confusing system that was created. A website that crashed where you couldn't even report things, where you couldn't report your work information. So, and what we know is that Medicaid and health insurance is not a reward for having a job. It's something that keeps you healthy. It keeps you from taking sick days and from losing paychecks. It allows you to take care of your family members and, and to protect your community. So that this myth that somehow work requirement reporting for Medicaid is going to, one, magically create a bunch of jobs, and two, improve anybody's health. Arkansas tried it and it didn't work, and it hurt a lot of people in the process. 18,000 people lost their health insurance during that time. And then I would say the third maybe myth area is around immigration. So many provisions of the bill attacked immigrants' healthcare. So a big myth is that undocumented immigrants are eligible for Medicaid. It's just not true. The only coverage paid for by Medicaid for undocumented immigrants is emergency care in like hospitals. So hospitals are paid for emergency care. What this law does is it removed coverage from legally present documented immigrants from Medicaid coverage who qualify, and for marketplace coverage. And it includes women and, or not women, adults and children, removing Medicaid coverage from people with refugee status, people with asylum status, victims of human trafficking, including immigrant children who have legal status, law are going to lose coverage under this new law. So this idea that fraud and abuse, work requirements, and somehow immigrants, it was just a lot of cruelty into this bill. And I think we should be kind of lifting that up.
Definitely. So, I mean, I like the way you put it out there, made it plain. A lot of people think that this is stopping scamming and fraud, and this is not addressing any of that. And like you said, most of it happens on the provider side in the billing process, the work requirements. There are a lot of people going to lose coverage because they don't have the ability to work, or the jobs are not out there. There's not a high demand for them to be employed. And, so we have to really, understand that, people are not trying to miss the opportunity to go to work and get a paycheck. You know what I'm saying? Some people just cannot do it because of the circumstances that they're in and their experiences. And then last, about undocumented people receiving health care, you spelled it out for us, you know what I'm saying? The only thing that's happening is in the emergency cases, which hospitals provide care to anybody who shows up. And so all of those three things that are being talked about and is fueling the conversation on this is why it's a good thing. We can dispel all those rumors and those myths and those lies, because they're not addressing any of that. It's about people losing coverage, basically. Millions of people losing coverage.
Yeah. I don't want to, and we could talk, I want to answer questions about, if people want to get into, the specific parts of it, but I'll try not to get too in the weeds. But like our ability to continue our Medicaid program is so reliant on federal dollars. Like it does not work without it. Arkansas gets a really good deal for its Medicaid expansion. The federal government pays like 90% of it. We pay 10% of it. Mm-hmm. And our ability to come up with our cut is going to be limited in this bill. So this bill kind of hits coverage and healthcare in a bunch of different areas, that weakens the 2010 Affordable Care Act, which is an overwhelmingly popular law now. Maybe at the time it was controversial, but 15 years nearly down the line, and we in some ways don't realize how we've been protected. Our insurance rate dropped, kids' uninsurance rates dropped, more people are able to go to the doctor, and so when we think about the ways that Arkansans are going to be impacted, it's all of us, and in some real cruel ways. So I think that part of our work at Advocates is about kind of shifting into sounding the alarm and doing accountability and consciousness raising on, as these provisions start to take effect, which they come in effect at different points. And some of them don't even come into effect until after midterms because they're that unpopular. So they knew that they needed to push those down the road a bit so we're not feeling the pain all at once. And I think that just goes to show that this was not a popular bill. It was passed, and parts of it were being written the morning they voted on it. So we didn't even get to do a full analysis until after they passed the bill. So this was not a process by the people for the people in any way.
Well, I think that's definitely something that resonates with people here in Arkansas when it comes to legislation being passed before we got the opportunity to fully digest it and pick through it and see what are the pros and cons? We've experienced that here lately a lot. Um, and you really kind of talked about what I was about to ask you next. And so if you want to just elaborate on it. But my next question basically was with Arkansas being a Medicaid expansion state, how do the federal cuts, intersect with the state level politics? And is there a strategy to protect what we've gained?
Yeah, I think in some ways, we don't realize, how, I don't know, precarious, how it could fall apart. So, right now, at Advocates, our focus has been a lot on storytelling around the state of folks with Medicaid, and our I think over the past 10 years, again, Arkansas was one of the first, like the first Southern state to pass a Medicaid expansion. We have experienced a level of protection that some of our surrounding states haven't. During the last 10 years, surrounding states that didn't expand Medicaid saw the closures of rural hospitals. Arkansas didn't. We have a lot of challenges in healthcare in Arkansas. And our ability to finance improvements are going to be limited now. To overcome budget shortfalls are going to be really difficult to do. But as for if you're asking, and just to make sure I hear you right, what's on the table, what do we need to be doing? Is that kind of what you're asking?
Is there a strategy that's already kind of in place that people are doing to protect, like I said, what we gain?
So I guess I'll go sort of big picture, thinking locally, and then or small picture, thinking locally, and then kind of big picture. So, please, get connected with Advocates. If you work in healthcare, if you're a healthcare worker, if you're someone who cares for someone with healthcare needs, if you have a story, we want to hear from you. We want to get folks plugged in because a lot of what's going to happen now is around sounding the alarms, recording what happens when new provisions come in, boosting what's happening that people may not know about, and also helping people navigate all of these changes. So part of our role is an education side, because not everybody wants to dig through all the provisions of these and know, what do I need to do now? What do I have to do to keep my health care? And so we want to help people as much as we can. And we want to help train people to be advocates for Medicaid and for, healthcare in their own communities. So getting plugged in with organizations like ours, like the panel, like Arkansas Community Organizations, who's doing a lot of work around Medicaid advocacy, is a lot of the local side of things. When I think about big picture, about reimagining what the health system should look like, because I think over the past several years, and probably since the pandemic, we have, broken down our health system in so many ways, and our COVID literally cooked our brains and figuratively on understanding what health looks like. So one thing that I empathize with the maybe Make America Healthy Again, or the other side who's trying to shape the health system now, is that they've connected with the reality that there is a problem. There is a deep problem, that we need healthy foods, healthy environments, less pollution, and that, health is an important part of, our lives. But their solution seems to be just blowing up our healthcare system, and to take this really individual approach to it. And I think that we have to communicate a better vision of what public health looks like, and a better vision of preventative health care that includes coverage for everyone to live healthy lives. Everybody benefits in a community when you don't have a bunch of uninsured people who can't go to the doctor. When you work with someone who can't go to the doctor because and, to help with the flu, and your entire office gets the flu, that's not great for everybody. When your kids go to school sick because they couldn't stay home, because they're sick and have a fever, and you have an entire class who's now sick, thinking about healthcare in those ways, the ways that we all benefit whenever people have access to healthcare, is how we should be describing it. And it's everything from our environments to our prevention. We are all kind of reliant on that. And so when we think about the ways that Medicaid works, in the same ways that taxpayers pay into roads so we can all drive on them, that we pay for firefighters so whenever our house burns down or catches on fire, we don't have to pay $10,000 for firefighters to come out there. When we contribute to a health system for the most vulnerable people, we all benefit from that. And I also think not just people who are insured through Medicaid programs are impacted by this. So again, before the Affordable Care Act, before our Medicaid expansion, uncompensated care, especially in rural hospitals, it's the only way. Like, if you don't have health insurance, you're going to the ER, and it is when there's an emergency and you have no other options. You think about how that rural hospital has to take on all those costs, so slows down emergency care. But then when those dollars don't come in, that hospital could close. What does that mean for the 70% of rural hospitals in Arkansas who are already operating at a loss? And what happens to the people who work in that hospital in Camden or in Dumas or in Forest City, who have that rural hospital that's like an employment hub too? So I know I'm going far with this, but I just want people to really think about what a health infrastructure looks like, and be like, hey, yeah, whenever my neighbor's insured and I'm insured and I have access to healthcare, we're all benefiting from that. My neighbor who's a nurse can have their job at the local hospital. The food service worker who works at your local hospital, without those dollars, without those, critical rural hospitals, those are jobs as well as healthcare for people. So I want us to think about what does it look like to have a healthy society? Is it that we're all in our little individual pods drinking our raw milk or whatever? No, it's when everyone has the conditions to be healthy, to go to the doctor when they're sick, to go get preventative care, to get their labs, to catch things early. So when you just cut a bunch of dollars for the next 10 years, you're divesting from our health in Arkansas. So I know that was super long-winded, but I'll get off my soapbox about big picture.
Stay on it. No, I like
this is the Camille Healthcare TED Talk hour, I guess.
But because people need to understand this. I like how you you connect it all. A lot of times people don't see how it impacts them until you build the tree or you show the ecosystem out through all the connections in the ecosystem, how we are all connected to each other. Some people who know me know, please tell. You can miss the meet. You don't have to come in the office. I don't want to, end up sick because you felt the need to be around.
Yeah, but here's the thing, Osiris. I worked at the health department during the beginning of the pandemic, and I was one of the first contact tracers for the state. And this is not me speaking as a former representative of the health department, but I remember calling people during that time and telling them they needed to quarantine, for 14 days. And they're like, well, you going to come pay my utilities bill? Because I don't have sick leave. I can't miss hours. I have to go work sick. So when we think about the ways that our economy and our everything in our community is not set up to make us healthy as a community, it is a problem. I don't have a good response for that sometimes. I do want to tell people, yes, if your kid's sick, stay home. But if they can't afford childcare,
right,
how are they supposed to? People will make the decision to be like, okay, well, I gave them a fever reducer and they seem to be doing okay. So, I got to go to work. or I'm going to lose, out on an entire days of pay because I don't have sick leave. And then if we go back to the idea of work requirements is, oh, what if I don't meet the number of hours that this bill is going to require I have because I was sick? Will I then lose my health care? So again, it's just every step of the way should not be made more difficult to stay healthy and to care for your families. Especially, I mean, like people are struggling every day, groceries, utilities, things like that. I talk about my own upbringing. Like my family filed, my mom filed for medical or for bankruptcy when I was a kid over medical debt, and like that is something that is so destabilizing to like anyone's lives and for years. So if we want people to come to move to our state and to raise children and to, have thriving communities, we need to make it to where their lives can be better and that they can be healthy. Part of that is health insurance.
Definitely. And thank you for connecting all the dots to that, because I'm saying you show what you care about by what you invest in. And so when people are intentionally not investing in healthcare, that's a form of violence on communities.
Yeah.
You know what I'm saying?
What's the phrase? Budgets are moral documents. So they show what we care about.
Yeah, most definitely. And I'm thinking about, like, we need to hear people share their stories more. And I know a lot of times people are reluctant to do that, but just in hearing about all these cuts, I know I've heard people mentioning how Medicaid was the primary payer for their loved one in a nursing home. People, I believe around 40% of births are paid for through Medicaid. And so, there's a lot of things that we don't think about because we may not be going through it on a day-to-day basis, but it's an impact on us, it's an impact on our neighbors and our communities. Have you heard any stories that you personally felt that people necessarily may not have known about, a real story or a data point that shows like the human cost of cutting Medicaid in a state like Arkansas?
Yeah, I mean, we've heard a lot of these, but I guess thinking on a couple, you mentioned kind of nursing homes and there's these areas of nursing homes and home-based healthcare, some of the most expensive long-term care are some of the most expensive areas of Medicaid. So even if someone who's in a long-term care or home-based healthcare has that coverage, even if they aren't losing coverage directly, all data shows that it's one of the first places that whenever you have budget shortfalls, that's where they're going to go to look for cuts. So seeing people's, the amount of nursing hours that they could have. So maybe because of budget cuts, if they're like, all right, you can only have X number of hours of a skilled nurse to come to your house. You'll have cases of people who were left alone for hours, like in their own soiled clothes, who are bedridden, who need that help and aren't able to get it. And so I think about those sort of casualties of these cuts. I also think about some of our storytelling work. So Medicaid is the largest payer of addiction and substance use treatment in the United States. And we did some storytelling work with a treatment provider who works with, who they allow mothers to bring their children to keep their families together. It's really incredible programs. And the majority of the women who are in this program were insured through Medicaid. So your ability to recover, to get sober and to, thrive after a substance use disorder or, with a substance use disorder and recovery is going to be very much impacted if you lose access to that kind of treatment at a really vulnerable time in someone's life. And so people talked about losing coverage, and some of these women who lost coverage postpartum, who then struggled with relapse, who lost, custody because of that, lack of health care. And so that's one of those areas that I really think about. Women just trying to survive who've dealt with very difficult situations and who are trying to do what they can to be, to be parents that they need to be. And then I think maybe kind of distilling the work requirements argument. So in 2018, when Arkansas did its work requirements, the plaintiff for the court case that actually stopped that policy, a man named Adrian McGonigal, he had variable shifts, and you can look up his story, but basically he lost coverage due to a time whenever he was having some significant health issues. I believe he had COPD. And he went to the pharmacy after he lost coverage, and his COPD medicine was like $800. So he couldn't afford it. And he became part of the case that led to the end of that policy in 2018 after 5 months. And as I'm saying this now, losing your healthcare coverage, even for a couple months, means that if you have a chronic health condition, it can be made worse during that time. So it's not like your health stays the same. If you have a heart condition and you stop cold turkey on your heart medicines, you could experience a heart attack or heart damage, organ damage. Basically, it puts you in a worse position than you were before. Certainly doesn't help you get a job. And now that we've been discussing work requirements, there have been, media requests and people who were seeking out to speak to the original plaintiff, Mr. McGonigal. And unfortunately, he died last year of related heart complications. And so I just think about how when you take people's health care away, it's not some magic thing that's like, oh, now suddenly my life is going to be better. In many ways, it turns situations into crisis. So with our storytelling work, we're trying to kind of uplift and highlight, situations that people can identify with. That is just like, yeah, of course people need healthcare. Of course, going cold turkey on your antidepressant medicine is not good for your health and for your employment and your ability to be, a member of society. It's a backwards argument.
Yeah, thank you for lifting all of those experiences up. In particular, especially when you mentioned, substance abuse treatment and addiction. I work with the Little Rock Freedom Fund, and part of our mission is to give people second chances when they've been incarcerated, and bail is the barrier for them getting their freedom. And a lot of times when we give them the survey afterwards, they might say, hey, I really want to get back on my feet. I need to go to a rehab facility. And without Medicaid, some of those people would not get in those facilities because it's in the thousands of dollars just for even 30 days at a place. And then they want like half of it up front. So it might be $4,000 and they just want $2,000. And then before they have ended, they want the rest of it. You know what I'm saying? And I'm just like, man, who can afford that if you're already in a position where you're unemployed, you might be unhoused, you have children that you have to take care of too. And so those are huge costs to people, and Medicaid covers that rehab. And even then, a lot of times they only accept Medicaid at certain points in the year because a lot of people, the demand increases as it gets colder outside. And so
100%.
A lot of people are not thinking about that as well too. I want to say this real quick. Anybody's listening, if you got any questions, we're about to wrap it up in a little bit. If you have any questions, please put them in the chat, and we'll try to answer them as best as we can. Well, Camille will. I don't know how much I can answer this.
Only ask questions that I know the answer to. No, I'm just kidding. If I don't know, we've been working through the bill. It's really dense. I mean, it's a really long, so if there's something that's like, oh, that's a good question, we'll always follow up with you. And but yeah, happy to answer anything.
Definitely, definitely. We're talking about the federal cuts to Medicaid, but also which, when I was talking to you earlier, we mentioned talking about provider taxes. Can
Oh
you
man.
just educate the impact on provider taxes and tell people what's just break it down to them as simple as possible about why this is important?
Okay, yes, I can, and I promise I will try to make it as like fun as I don't know if fun, but like we're not gonna. I'm not promise I'm not gonna get crazy into the weeds. I'm not an accountant, but the most sort of important thing to know is that so provider taxes, um, like I said earlier, we get a good deal for our Medicaid expansion. Um, we pay 10%, the federal government pays 90% of it. That 10%, our cut of that, is mostly covered by provider taxes. So, under federal rules that have been in place since the 90s, states can use these taxes on providers like hospitals, nursing homes, or managed care plans, and they use those taxes to raise money for our cut of our Medicaid program. So provider taxes are this like critical source of funding for Medicaid. We use them to cover the expansion, our part of it. We also use them to make improvements to our health system, to increase provider rates, to make sure that doctors, nurse practitioners, all these providers are making enough to cover the costs. So that's kind of what provider taxes do. They're how we raise the money for our part of it. So this bill has a lot in it about a permanent prohibition on any new provider taxes as of 2025. So if there's a shortfall in our budget to, if it costs more, if we have increased health costs in our state, if we want to make improvements, like if we want to make our health system better, like we did with some of our maternal health work earlier this year in the legislative session, if we want to make sure that, we raise provider rates for OBGYNs this year, let's say we want to do that with, I don't know, pediatricians or another group that are, struggling to take Medicaid patients, we can't do that anymore. We can't follow the cost of that. So basically, provider taxes and the stuff in the bill about the provider taxes are kind of about tying our hands as to how we can raise money and what we can, our ability to do it, to do investments in our healthcare system. So most people are like, well, I'm not a provider. I'm not going to be impacted by it. But it's one of those things that like you may not feel that, but your hospital's going to feel it. But your health system's going to feel it. It's the big things that affect like everybody. So I hope that kind of explains it a little bit. It's how we raise money for it. And we can't raise money in the same ways with this bill now, with this law now.
Definitely not. You explained it. I got everything.
I hope that helps. And again, I won't claim to be the tax expert, but that's probably the easiest way I can maybe explain it.
Yeah, no, definitely. I think you did a good job explaining that as well. So, this big, not so beautiful bill, maybe we should rename it that. You know what I'm saying? It's a lot of like I say, detrimental consequences. A lot of harm is going to be caused by this. Millions of people are going to be impacted. Arkansas is going to be definitely impacted. The Delta in the South definitely is going to be felt because it's going to really impact our rural communities as well. And so this is something that everybody needs to take an interest in because even if you feel like this may not apply to you're good, your insurance is good, you make enough money. It's more. It's not an individual problem.
Well, I don't know if you saw, but I mean, it definitely affects everybody because like insurance providers just announced that they want to raise premiums by 25% in Arkansas.
Yeah,
So,
you're right. I just did see.
we're all definitely impacted by
Matter
it.
of fact, I tweeted that. I tweeted that because when I tweeted it, it was funny little story. I won't be long winded, but Venus Williams went back to playing tennis recently, and then
Yeah.
in the interview they were like, what she wanted to match, and she came back, and they were like, "What made you want to come back and start playing tennis again and come out of retirement?" She was like, "My health insurance." Like,
Yeah, exactly.
I found out that I got switched to Cobra, and I was
Cobra's
like,
expensive.
she was like, "I need to start playing tennis again because I need my health insurance." And everybody laughed in the crowd. And then the first thing I said was, it was funny in the moment because she just kept it real. But I was like, but this is the reality in Arkansas why some people aren't leaving jobs, and people are trying to find work because they need insurance and they need to find a way to pay for it. And so, because
Yeah,
our rates are going up by 25% here.
yeah, and I mean, and the reality is that there are people like you only get insurance through your job. It most of the time, if you're for many places, if you're a full-time worker,
Yeah.
but people are working 2 or 3 part-time jobs.
Yes.
You know, like they're not getting their insurance from Uber and DoorDash and all these kind of places.
Yeah.
That's not how people are, becoming insured. Some of them are purchasing on the marketplace, and able to get lower costs. We won't get into the enhanced premium tax credits today, but yeah, like this idea that if you work, you will just magically have insurance is one, not true, but two, like if you want people to be insured because they have a job, they need to have jobs that provide insurance, which a lot of people, especially in rural Arkansas, especially lower income workers, do not have access to. And that is why Medicaid is so important, because it makes sure that people can have insurance coverage if they meet an income threshold. That's what Medicaid eligibility on income is. And going any further than that is just making people's lives harder, for no reason other than punishment.
Yeah.
I just don't understand. And I mean, like on a big soapbox level, is like we are just so focused on punishment in this country in every way, from our healthcare system to our justice system. Can we please just stop punishing people?
Yeah. We gotta do some brainstorming on how do we explain to people that punitive
It's just
don't work.
it's in a culture of punishment right now. And I feel like screaming all the time. Like, it doesn't have to be like this. We actually don't just have to do a politics of punishment all the time for every area of politics or policy.
Yeah. It's gonna take a mass movement where the 99% of the people realize that the 1% should make all these decisions, and we shouldn't allow corporate interests and these elitists to make all the rules.
Yeah. Well, and the stat is, what is it? It's 3.5% of a population or what you need to sustain a movement. So whereas the 99% of us, we're all impacted by it, I think it takes fewer of us than people think to make a difference. Yeah. And you don't have to do everything. You just have to do something.
Yeah, most definitely. So definitely tap in with people like you, Arkansas Public Policy Panel. There's a number of different organizations around here working on all of the different issues, not only just with healthcare, but education, civil rights, all these different things. I didn't get any questions in the chat, so I guess we're answering everybody.
I answered everything, clearly.
Yeah.
No.
I got one last question for you, and then
right.
any announcements that you might have. To anybody who's listening, and we're going to record this so we can have some playback as well too. So anybody listening or will be listening in the future that wants to become an advocate today, what are the top 3 things you would tell them to take? The top 3 actions they should take this week to defend Medicaid in their community?
Ooh, that's a good one. I don't know if I have 3 really stern ones, but I mean, the first would be
anything.
Connect with us wherever you are in Arkansas, at Arkansas Advocates for Children and Families. We really need a grassroots statewide campaign calling for protections, investment in healthcare, We need, leaders around the state who are ready to go. I would connect with others. You should be talking about this. You should, try to do your best to educate yourself on what's going to happen, and talk to other people about this. Do your own small level micro organizing on top of getting connected with grassroots organizers.
Right.
On sort of a big level, like kind of overarching, I want people to stay connected, and staying connected does not mean doom scrolling with all the bad things and just absorbing it all. So like there's a balance between knowing and being informed, and then just like the shrapnel of all the things at once. So create boundaries in that kind of way. Get involved, but don't take it all on your shoulders. There are other people who want to help. And we'll be releasing an advocates, and this is back to kind of our work. We'll be releasing some things in the upcoming weeks around like what the stats are on healthcare and kids and families insurance. So stay connected with that, follow along, share that. Connect with us if you want us to come speak at your organization, or if you'd like to do trainings or anything. We want to be useful. And then I don't know if that was 3 or just a hodgepodge, but I would say be connecting with your legislators. All of Arkansas's congressional delegation voted for this bill. And there's been some bipartisan concern that they pass something that's going to be terrible, because they pass something that's going to be terrible. So even though the bill is passed does not mean that the process is over. You should be contacting your senator, your member of Congress, and telling them how concerned you are now that the new numbers are out from the Congressional Budget Office, and say, I'm really concerned about my rural hospital. Like, what happens whenever it closes? Like, I'm a nurse. I'm worried about losing my job, or I'm worried about my mom losing her health care, those kind of things. So stay involved, get involved, stay involved, have boundaries.
Cool. Well, thank you for all of this information. Once again, this is the Friday webinar series. We're talking to Camille Rashu today. Do you have any announcements before we get out of here?
I don't have any announcements. Nothing. We'll be, like I said, we're putting out some things about the bill and some upcoming publications coming out. That's kind of the main ones. So just keep an eye out for things that we'll be releasing. But as far as I know, and I'm about to go on vacation, so I may be forgetting something. No big announcements right now.
Oh, well, I'm going to say congratulations to the Arkansas Advocates for Children and Families. I heard that y'all secured the Jack Stevens Centers for Soup Sunday, March 1st, 2026. So that's a big thing right there. I'll just say congrats to y'all for securing that stadium, that arena, for y'all big fundraiser.
I show up and volunteer and do what I'm supposed to be told. I would never claim to be involved. Like I'm not involved in the planning of it. It's the most incredible event. I show up and one of my colleagues says, go here and volunteer. And so I'm a good soldier in that way. I'm medicate most of the time, but yeah, I feel like it's an announcement to me, but I've also again been out of the office. So that's
good. Hey, look, I just followed the Mighty Rib page, and they just announced it.
Yeah, so. Thanks to the Mighty Rib for being the chair of our Soup Sunday and always getting the word out. Very great advocate for our Soup Sunday work. Mighty Rib, if you're watching, shout out to you.
you know they're watching, man. We popular like that.
Yeah, of course.
Well, thank you for being here on this Friday webinar discussion. We got a lot of good information about federal cuts to Medicaid, how it's going to impact Arkansas. We learned about what provider taxes and how they're going to impact the funding for this in Arkansas and federally as well, too, and the harm in that. And we got some tips on what we could do. We learned about our stories and our shared experiences. This is a good conversation about the big, not so beautiful bill. Thank you, Camille, and until next time, peace, y'all.
Bye.